Good evening, meatheads. What's up? Back from an excellent weekend in California for the CNA Fit Expo and Static Monsters. Really proud of how all my athletes did and everybody out there. It was a great comp, and I can't wait to hopefully participate next year when I'm not so injured. In any case, we're back for another Meathead Minute, and tonight I want to talk about a follow-up to the last one, which was about chasing optimization. And tonight we're going to talk about one of the ways that people tend to do that, and one of the things that has kind of fueled this chasing of the perfect thing, and that's overdiagnostics. Now, when I say overdiagnostics, I mean testing for far too many things that either have a minuscule effect or just don't need to be tested at all. And this is a huge problem in the healthcare system right now, not just from a financial standpoint, but actually from a patient standpoint as well. And there's a couple different things to talk about to break this subject down. I won't go into too much depth because I'll probably bore you. But one, if you're getting something tested, think about what you're looking for. I would always tell this to my interns when I was a resident: don't test something or ask a question that you don't want the answer to. Because if you get an answer, you gotta dig deeper. The same goes for some of these special tests that a lot of these functional medicine physicians are getting. You know, all of these different blood levels of enzymes and, you know, iron breakdown products and things of that nature. These are all really cool tests, but we don't know what they mean yet. In most people, they don't mean anything. They don't actually correlate to any differences physiologically that we can measure at this point. So they're kind of just numbers that'll stress you out. They're unnecessary numbers that may actually have a negative effect on your performance if you see that something is quote unquote out of whack. This is part of that nocebo effect that we've talked about before. It's one of the other reasons that I'm not the biggest fan of some of the sleep monitors and the heart rate variability monitors, because, you know, if you see that you had a bad night's sleep, or if you see that your heart rate variability is not great one morning, you know, that's going to be in your head when you go into your workout. You're like, oh, well, I must not be properly recovered. And they've actually done studies that just that knowledge, whether it's true or not, will decrease your performance. So the same goes for some of these lab tests that you're like, oh, well, my, you know, apolipoprotein A subunit B is not what it's supposed to be, so I must be unhealthy. Well, we don't really know what all of those proteins mean yet, so I wouldn't stress about it too much. And it's why most people don't test those things. If you're going to somebody, especially if somebody in functional medicine, they love to test a bunch of nonsense, and be careful, because one, you're going to pay for those tests, and two, they're going to give you information that you don't need that's probably not going to be helpful. Now, once again, I defer to your personal medical professional because they know your history, but just be careful, be wary. Because if you get these answers that you don't want, you might wind up having some effects on your body that you don't want. This same thing goes for imaging. Everybody wants an MRI, everybody wants an X-ray to see what's wrong with their joint. Stop it. I'm going to say that again, stop it. Just because a joint is in pain doesn't mean there's something on imaging that is causing that pain. And just because there's something on imaging doesn't mean that that imaging is causing pain. You know, I posted an infographic a while back about all of these asymptomatic patients with radiologic findings on MRI. Greater than 80% of asymptomatic patients have herniated discs on their back MRI. They don't have back pain. If you MRI somebody's back who does have back pain, there's an 80% chance they're going to have a herniated disc, but that likely has nothing to do with their pain. So be careful getting these MRIs, getting these imaging, and pushing your doctor for it unless it's indicated, because ultimately you may wind up getting information you don't want, and then what's going to happen? You're going to know that disc is there. So anytime your back hurts, uh-oh, what's wrong with my back? What's wrong with my disc? Did it bulge more? Is it worse? Is that what's causing my pain? And in your head, this pain won't be able to get fixed until that disc is fixed. I've seen this with lots of patients, and they wind up getting unnecessary surgeries, injections, RFAs, things like that, when it could be treated with corrective exercise, physical therapy, and conservative management. Now, this goes for not just the back, this goes for other joints as well. And once again, everybody is different. I don't know your personal medical case history, and there may be a situation in which this imaging is needed. But be careful asking for unnecessary imaging just because you want to know what's going on. Knowing exactly what's going on in the joint often is not going to tell you what's going on with your pain. So I could go on about this for hours. This is a soapbox that I am very comfortable standing on, but I don't want to bore you to death. So just think twice before you want to get more and more detailed data about what's going on in your body. This detailed data may not be helpful because once again, you're going to wind up chasing optimization instead of sticking to what's simple. Getting a good night's sleep, having good mobility and stability of your joints, eating well, training hard, and not acting like an idiot. All right, guys, that's all I've got for you tonight. We are going to talk about some more interesting stuff over the next couple of weeks. And the Dr. Meathead t-shirts, Health Through Strength, with the logo on the back, will be available online shortly. In any case, it's great chatting with y'all, and I will see you next time. Dr. Meathead out.